Okay. Hello everyone. We are A7, Group A7, and this is our topic, Words on Cancer, Year 40 to 3. And this is our outline of the presentation. So, the start of the work. In 1971, USA President Richard Nixon signed the National Cancer Act of 1971 into law. And most of people think that this passage will lead to a cure for cancer. Lead to a cure for cancer within a few years. However, 40 years later, the work is still being waged. So this is the cancer mortality rate, and we can see the increase. We can see the increase through the 1980s and the 1990s. And finally, the decline since 1991. And you can see that we have made great progress. But there is still a long way to go.
Well, let's talk about the strategies in the war against cancer. First of all, screening is one of the strategies. When it comes to screening, blood tests, X-ray, and a wide range of tests come to our mind. It is generally believed that screening is beneficial to our health, since it may avoid death in advance. However, the public seldom keep in mind that screening tests actually has some potential harm in addition to benefits. For instance, some screening tests may cause bleeding and other health problems. Moreover, false positive results can give rise to anxiety, while false negative results may lead to delays in diagnosis. What's more, overtreatment is also possible. This happens when screening test correctly shows that the patient has cancer. However, the cancer is actually slow growing and wouldn't have harmed the person in his or her lifetime. In other words, treatment for such cancer is unnecessary. This is called overtreatment. Now that the traditional screening test has so many risks, scientists have developed a rather smarter way called genomic testing. Genomic tumor assessments enable us to better understand what is actually going on in the tumor cells. Genomic testing, after we identify the gene mutations in the tumor cells, we are able to target on the individual tumor in the individual patient specifically. And it is promised of precision cancer screening. After treatment, patients usually have several options. In fact, most patients have a combination of treatments, such as surgery with chemotherapy or radiation therapy. Patients may also have immunotherapy, targeted therapy, or hormone therapy. Meanwhile, a clinical trial would be another choice. Clinical trials are research studies that involve human beings. After fully understanding what these trials are and what they are for, the patients have the right to make the final decision. With the efforts of the medical researchers, clinical trials provide alternatives for us to find more effective and safer treatments for cancer.
Okay. And even doctor knows that prevention is more important than the cure. And so let us talk about the third strategy of fighting cancer, prevention. Okay, here are the common risk factors of cancers. And I think most of people know that smoking is the number one risk factors of cancer. But however, look at this. More than 20% of Americans are still using tobacco. So what does it mean? It means that there's still a significant potential in reducing cancer if prevention is properly done.
Okay, so how can we take precautions against cancer? First, we can put efforts on controlling our diet. It is said that you are what you eat. So choosing food for our health means the right amount of nutrition that is required in daily meals. For example, soy and flax seeds produce a chemical compound called phytoestrogen, which prevents breast cancer. Besides, eating smartly, avoiding carcinogens like cigarettes, alcohol, and junk food, it can effectively reduce the risk of cancer. Thirdly, stay fit. The data has shown that obesity is one of the common factors developing cancer. So maintaining the body weight can keep us healthy, active, and fit. Regular exercises and keeping a low-fat diet can effective in preventing cancer. As last, take a health examination regularly. Before going in for any treatment, it is best to self-examine our body. So we think it is a good precautionary measure for cancer.
At the end of this presentation, I'm going to make a small conclusion of what we just talked about. It was 40 years ago. It was 40 years ago that we launched the war on cancer. We fight with knives, laser, radiation, chemical weapons, and we target tumors, we run scans and tests. We have done a lot of things. We have fought hard, but the battle is still on with cancer threats in our lives. So, what should we do? We have to look for better strategies. In the past 40 years, we have made a lot of progress, but it is still not enough. How about the next 40 years? So, novice testing for more advanced, they need clinical trials for more advanced treatment and analyzing risk factors for more effective prevention are important